Okay, so right. So without further ado, let's crack on because we've got lots of interesting stuff to get through today. So first of all, we've got on the agenda Nami, and she is. I was chatting to her yesterday, and oh, there you are. Already lovely to see you. And I was chatting to her yesterday. There's a very interesting new funding opportunity, and Nami is from, well, she's doing this research for Imperial College, but it's really interesting. So I won't steal Nami's thunder. So if you want to go ahead and tell everyone about it, that'd be great. And we're going to have some questions at the end.
Absolutely. Good morning, everyone, and thank you so much for making time for me at this meeting. And thank you, Toby, for inviting me. So I'd just like to give you the overview of what I'm doing. My background is working in the community and voluntary sector, so developing and delivering community projects, but mainly around health and wellbeing with a focus on mental health for communities. And that was mainly in Kensington, Chelsea, Westminster and Hammersmith and Fulham. I'm now working, just doing a short piece of work with the Imperial Health Charity, which is part of Imperial College. And what they've asked myself and my colleague Linda to do is to help them shape a new grants programme, community grant scheme for 8 Northwest London boroughs in response to COVID. So particularly looking at supporting organisations that are working directly with communities that have been impacted by the pandemic. So that could be anything, but they want to have a particular focus on health and wellbeing outcomes. So supporting people to live happier, healthier lives as far as possible at this time. Now, the Imperial team are aware that there's so much going on. People are being impacted in different ways and at different times. And so one of the things
this time we leave 20 mil in top.
If everyone could just put themselves on mute at the moment, please. We're getting a little bit of feedback. That'd be great.
Yes, so the Imperial team are really clear that, they understand that people are being impacted in different ways and different times. So one of the things that we're doing is where we are talking to individuals and groups across Northwest London just to introduce the grant scheme, and as it's still being shaped at the moment, just to understand what local people think the funding priorities should be. Well, I do have a couple of slides that give you an overview of the grant scheme. Is it okay if I share those?
Yeah, of course, go for it, yeah.
Thank you. I just need to find them now. Do that. Oh. Sorry. There we go. Okay, so as I say, the funding opportunity itself is called Compassionate Communities. So you might hear about this over the next couple of months because Ealing is one of the boroughs where organisations will be eligible to apply from. So it's for community groups. Now, they don't necessarily need to be constituted groups or formal charities, just groups that can demonstrate that they're working with local people. It's to support communities who have been really affected by COVID. And really, the fund is looking to support groups that have really strong relationships with communities and also good partnerships and networks. So I just wanted to have a bit of a chat with you guys today. And I know it is a big group, and obviously I don't know all of you, so it's kind of, it's quite difficult for me to kind of capture this, but it would be really useful if I could get an insight, maybe if any of you have any anything that you'd like me to feed back to Imperial around what you think the funding priorities should be for this grant. Because we're putting it together with them quite quickly over the next couple of weeks, and the idea is that the fund should be available in kind of mid-December, January to apply for. So I was wondering if any of you had any sort of priorities that you'd identified that you think the Imperial Fund should particularly be supporting for communities in and around Ealing at this time.
Can I maybe go first and just tell them about the couple of things I discussed with you yesterday, just to get the ball rolling? So with Naomi yesterday, I was talking about the food bank in Ealing and how obviously that's drastically increased the amount of people having to rely on that because of unemployment, and also thinking about the fact that a lot of people in temporary housing. So that's why the food bank is giving people meals that are easily can be easily heated up, but of course they're not very nutritious and don't really help you with your mental health when they're very sort of processed, high sugar, high salt. But a lot of people don't really have the setup or the accommodation to cook healthy meals. But I was saying really that at the moment, you know, it's a nasty combination of lack of unemployment, stuck at home, having to rely on home and with a variety of different housing circumstances, having to rely on food banks, and also the lack of access to services online because of the cap on if people have got Wi-Fi tariffs, and a lot of things like this on Zoom eat up a lot of data, so people can't connect to services. So it's a nasty combination of different factors at the moment that are increasing sort of mental health problems and making people feel also very physically unhealthy, as well as, you know, very low mental well-being. So I don't know if anyone else has got any thoughts they'd like to chip in with.
Yeah, can I?
Yeah, go for it.
Yeah, fantastic. So, well, I don't have anything like specific, but like one of the first things that kind of jumps to mind with me is I think one of the areas of Ealing that's been impacted most has been Southall. And I know there are kind of a number of groups around there who've sort of reported a lot of difficulty. So it would be nice to see some funding going towards, you know, that area of the borough, at least, I think. So, but obviously I think it would be, yeah, a good idea to speak to some of these groups more closely, and I think they would give you a better idea of what's needed than I could, but it would be a good place to start looking, I think. So.
That's
Who do you think, Kelvin, in Southall, which do you know any particular groups that might have some first-hand experience?
Oh, I'd probably.
Hello, everybody. Shamaka here. Hello.
Yeah, there we go.
Hi.
Hi there.
Sorry, I came in a bit late. We've seen a spike in Southall, and it's been ongoing for quite some time. It's just that. Hello.
Yeah, we're still here. Yep.
Yeah. It's just that if you look at Southall, it's you have a lot of people actually coming. So it's not just people who live in Southall, but because it's like a hub area for a lot of communities. So people are coming from all different areas of Ealing to come and shop, and and again that also contributes towards the escalation of infections, and also it's just the nature of Southall in terms of the shops. So if you go to some of the shops, we've recognized that some of them have not been, people haven't been keeping social distancing. So we had a few people going around who speak different languages, speaking to, some of the shop owners. And also there is a cash and carry in Southall, a big one. And they've tried, I think, to do social distancing, but just that people are, you got people like outside picking fruits and things like that. And again, there's no social distancing. And also, I think the messages, again, we always come back to this, the messages around COVID-19 is still confusing to a lot of people. And also South people, as I said, from different communities, speaking different community languages. So there's a lot of contributing factors to the issues. Yeah.
Thank you very much. Are you linked to an organisation in South?
Yeah, we are actually we are based in Southall. So we am from an organisation called GOSAD. So yeah, so we are, our primary office is in Southall, and we are open. Actually, we are open. So we've been seeing clients and we've worked in the area for the past 16 years.
Okay. What I've done is I put our email address in the chat. It's info. I've said please email info@futurebitesolutions.co.uk if you'd like further information on the grant scheme, or if you want to have a discussion about local priorities. I can't take your email address without written consent because of GDPR. So if anybody here would be interested in finding out about this grant scheme, we're going to try and make the application process as simple and straightforward as possible. Please do send us an email so that I can add you to that mailing list and so that you don't miss out.
Sorry, can I just add, sorry, it's Anna from Polish community. Can I add one point, because I think it would be important for others to hear it.
Yes.
There's also a large number of Polish clients, the rough sleepers that have been housed in various places all over Ealing and Hounslow, and in some places they are in hotel, in some places they're in private accommodation, and large numbers in Southall, Acton, Southall. The problem is, I mean, when we talk about funding application, I can say to you straight away, as a small organization without any employed people, including me, we don't have a time capacity to write funding applications. And even if it's simple, it's not only about writing application, spending time on it, but also it's about managing. So the monitoring and evaluation, we have no time for this whatsoever. So probably there are other grassroots small organizations that are in similar situations. So my message to other organizations in Ealing would be that many smaller community organizations are they have strong connections with communities, and we can be a bridge connection to the community, but we need someone like a partner that, you know, we could work in collaboration. And I'm not talking about consortium because it's very complicated legally, but I just want to, you know, spread information there, because recently, within last few months, we had few deaths in a group of rough sleepers. And one of the person we actually, as a small organization, organizing funeral and all affairs. One person was it was a problem that two rough sleepers severely wounded the person. They are the third rough sleeper that he had died. So the issues are strong. I mean, so challenging because people are housed, and it's not only about the food, it's also about they being bored and they acting out the aggression, you know, the emotions. And it's really hard to work with them. Even my friend from Hounslow, who runs Polish organization, she delivers food, but she had some challenges, even delivering food to those people, the most vulnerable. Some of them, they have, you know, personality disorders, depression, and many other problems apart from substance misuse issues. So it's quite complex, and I'm sure Toby knows, is aware of what I'm talking about. But as an organization, we're not in a position to apply for funding. So I think it's something for other organizations maybe to consider how we can work together with small organizations. Thank you.
Anna, thank you very, very much for that. That has come across in lots of the conversations that we've had with community organisations. And there are two, Imperial are thinking about two things, or we're encouraging them to think about two things. Either that they have an officer who's able to help organisations, so have a conversation on the phone about what the organisation does and what it would like to do with the money, and then kind of completes the application form on their behalf after a conversation. Or alternatively, there are slightly larger grants that are for partnership projects where there might be an organisation that does the administration and then kind of administers the grants to smaller groups. But that is something that's come across time and time again. There are some comments as well. So there is a comment from Ellie, who has about 300 families in and around Southall. Ellie, please do email us so that I can make sure that we either...
Now, so I was going to say quickly, we're working Southall and working with quite a few of the organisations there. And hi everyone, sorry I'm a bit late, but also in terms of things like the supporting organisations and like Poles in Need, we'd be really happy to look at that either as a standalone or potentially, Toby, if the CVS has a kind of an appetite to do a sort of to do the administration of a project like that. That's something we do work Ealing wide, and we've got our core funding sorted now, so we could provide administrative support without having to take a chunk of the money which would need to go to the vulnerable groups. So Naomi, I'll drop you a separate email about that.
Thank you very much. Thank you.
Okay, I've got two people who've been waiting patiently to chip in. So if I can just let them have a quick word. So Latvia, you wanted to go first, and then we've got Mandy afterwards.
Okay, thank you. I had a quick question actually. I mean, on your slide, it says projects to tackle issues like obesity and food poverty. But I'm sensing that it might be wider than that, or is it specifically that's what you're looking at in terms of the objectives that you want projects to work towards?
So the original Imperial were originally given the funding for this grant pot from the central government after Boris got COVID, and just all about obesity. So what we've done is, through working with them over a couple of months, is just to encourage the project group to understand that these are much wider issues, and that and also I have some I think I have some issues as well around talking to people about obesity at a time of kind of real food scarcity and food insecurity. So we've very much moved them towards kind of health and well-being in the widest sense. So the grant scheme will reflect that. It won't, obesity and food poverty are not won't be the correct part of the criteria. It will be health and well-being.
Right, okay, that's really, really helpful in kind of trying to understand where projects might fit in, or the kind of work that could happen. Can I just say, in terms of Southall, I think, you know, we know what the issues are in terms of BME communities, and how, particularly in Southall, I suppose, as a destination place for a lot of other communities, and the multiple household, you know, kind of occupied households there, and the generational impact. There is actually a difference between New Southall and Old Southall as well.
Okay.
And I think it's important to be able to reflect that, so that the needs are different as you move from the new part, either Broadway, down towards King Street. And unemployment is a much bigger issue in the south part, particularly for lone parents. And there are a number of issues around single parents, I would say. And I think that might be a consideration in terms of being a bit more nuanced, I suppose, in terms of targeting some of this funding. So I'm just going to leave it at that, really.
Thank you.
Okay, Mandy, do you want to?
Thank you. Thanks, Toby, for inviting me today. So, yeah, I've got an appointment at 1 o'clock. Actually, I'm going into another meeting, so thank you for that. But Naomi, I'm really interested in the work that you're actually doing there, and I think one of the key areas, perhaps, would be really great to have a consideration for is when we're thinking about building compassionate communities, is to think about the people who are quite vulnerable in terms of their mental health needs. So specifically around isolation, depression, people who can't get out, people who may have disabilities, and actually what that would look like. Because obviously, you know, I haven't introduced myself, but I work for the Ealing IAP service, and a service which is very much drawn upon for our support, especially in these current times where our waiting times are just increasing twofold. And one of the key things that's actually we're noticing is the lack of some of the things that we've already mentioned today, but the ability to have an impact on their negative impact on their psychological well-being through isolation and loneliness, and not having anybody to speak to in these particularly difficult times. So the idea of food banks is great, but you know, people coming to our service for support don't necessarily get that support in the due course and time they need it. So I think there is some consideration for us to think about these vulnerable people in this group. And we do quite a lot of cross-boundary working with some of the partners that are on this call, as well as many others. But I wonder what might you be looking at in that area, Naomi?
I think, Mandy, sorry, just in the interest of time, it would be really useful to have a follow-up conversation with you. So we have had quite extensive conversations with IAPS colleagues and mental health colleagues in some of the other boroughs to talk about some of these issues around isolation and waiting times and mental health concerns more generally. And certainly, as another piece of work that I'm doing with older adults in Fulham, everybody that has participated in my engagement sessions has said to me that they're really concerned about their and their friends, their communities' mental health, and also isolation. So it's definitely something that the Imperial team are considering. It's high on the list of priorities, but I feel like it probably warrants a slightly more in-depth discussion. So I can let you know who we've spoken to and the kind of themes that have come up so far. And then you can help me understand where some of the gaps are or what we need to understand about the context in Ealing.
Sure.
Okay.
Thank you, Naomi.
Okay, we've got 2 more people and then we better move on. But maybe, Naomi, I don't know if you want to come to the next meeting as well, in case people missed this one as a follow-up session. I'm thinking of doing one just before the Christmas break. So it would be Friday, the 18th of December. If everyone's keen to do another quick meeting before Christmas, and then maybe you could come back to that again. And
yeah, I'd be happy.
At least you've made some good contacts today, and it's great you've got your contact details in the chat. But let's move on first of all to Maureen, who had a question for Naomi, and then Steve's got his hand up.
Thank you, Toby. Hi, Naomi. I work for a forensic mental health team for West London NHS service, and a lot of our community patients reside in residential settings. And even though those residential settings have done a very good job to keep people active, you know, like walking groups, trying to get them involved in kind of aerobic exercises, we've gone into a second lockdown, and I've noticed right across the boroughs that I cover, because I cover 6 London boroughs, that they have put on quite a bit of weight, even despite the fact that the residential settings have done a tremendous job to try and getting people active. So I'm just wondering, is what you're proposing going to be looking at people that live in those kinds of settings? That's my question.
So I think in response to your question, I think people that live in those sorts of settings would definitely, you know, those needs are definitely in line with this opportunity. But it would be for your organisation or local organisations to propose a project or to apply for funding to continue an existing project. So the projects don't have to be new. You don't have to invent something new and innovative and exciting. You could be saying, look, I'm aware that these organisations are doing this work, but actually they don't have enough capacity, or they could do with some additional resource at this time. So that would absolutely fall under, kind of fall within the scope of this grant fund, but it would be it's up to local organisations to propose what the funding could be used for, if you see what I mean, when it comes out.
Yeah, that's fine, because I'm happy to work in partnership. I've just done a fund for something else, and I don't mind contributing to a fund, because we're the NHS. Obviously, we can't receive the funding, but we have got charity funding that I can access. But if it's better to work for a partner agent, community partner, I'm happy to do that, because I think that's better to promote those kinds of links within the community. So I don't want it to be with me. I'd rather work with somebody. So it's just a case of finding out who I need to work with, who to partner with, to ensure that we can deliver it to forensic to mental health patients. So I'm just putting it out there.
So anybody that would like my email address who doesn't see it in the chat, please just ask Toby, and Toby, please do pass on.
I will send it around following all these sessions. I will do it. Steve, you wanted to ask me. Oh, I've got feedback.
Yes, hello. I was really going back to the point that was made earlier about the difficulty for some community agencies to get involved in initiatives because of the, shall we say, the logistical problems of the requirements of coming into them. The reason this is of, shall we say, of concern to each is that we're about to get involved in a service to support test and trace messaging specifically within hard to reach communities. And one of the the way that we're hoping to deliver that is via the use of local agencies. So very much we've been trying to think about how we keep agency involvement within that as simple as possible. We will be looking to ask other agencies to join with us in consortium for this delivery. It's very much about this: how do we ensure that COVID messaging gets to the less accessible parts of the community, and obviously the way we wish to do that, or part of the way we wish to do that, is via the agencies who are working on the ground. So I think that it's very useful for us to hear, those concerns voiced, because I think this is always a challenge for smaller agencies, and perhaps it's incumbent upon some of the rest of us to do some thinking about how we ease that process, and how we obviously funds have to be accounted for, and that is always the, shall we say, the administrative burden, and results have to be measured. But I think we need, it's larger agencies and funding authorities do need to spend a little bit of time thinking about how they simplify that, so that the genuinely close contact agencies are able to work through initiatives.
Thank you. Thank you very much, Steve. I think, again, this is something that's come up a number of times with smaller organisations saying to me that actually it's the larger organisations with infrastructure and capacity that get all the grants and the projects, and sometimes it is difficult to access things. So we do kind of take that on board, and we are thinking about ways to support smaller groups to access themselves, or to kind of partner up with larger organisations. So I definitely take that on board. And Steve, again, if you'd like to have more information about the fund, please, I did put the email address in the chat, and I'll put it back in there again. But alternatively, you can ask Toby and he'll put you in touch with us.
Certainly, I made a note of it.
Okay, great, thank you. I'd just like to thank you all, because I think I've gone over my time. Now, I've just got a text from my son's school to say I need to pick him up because there's been a case of COVID in Year 6.
Oh,
so I'm going to go now.
But thank you very much for joining us, and yeah, maybe if you can come back again at the next one.
I'm very happy to, yes.
Brilliant, all right.
Thank you all very, very much. Thank you. Bye-bye.
Okay, Mandy, would you like to give us an update from IAPS?
Sorry, Toby, was it Mandy you said? Yeah, my turn.
Yes, just after a general update from IAPS, please.
Yeah, no, that's absolutely fine. So, I mean, within IAPT, obviously, a lot of you may be aware of what we do. I'm not sure, but essentially we're a service that provides access to psychological therapies, and we tend to take referrals from across the community from health professionals, as well as self-referrals. So if people wanted support, any form of psychological support, they could self-refer to our service. And what we tend to see is people presenting with any form of mild to moderate anxiety disorders. So that could be a whole spectrum there, to include things like generalized anxiety, depression, specific phobias, trauma, PTSD kind of work we do. So anything such as that. If you're not sure, obviously I can give you my details and you can be in contact with me and I can have a further conversation with yourself. The difficulty we're having at the moment with this current climate is that our waiting lists have gone up incredibly. And as I spoke earlier, a lot of the presentation is more around a heightened level of depression across the borough because of the lack of, support that there is out there, whether people are losing jobs, financial hardship, loneliness and isolation. So we're all contributing to kind of high levels of depression. And we're not able to see these people as quick as we would like because essentially the demand on our service is quite great. However, how we are working at the moment is we are continuing as normal in as much capacity as we can. A lot of the sessions that we are offering are based as what we call a primary care intervention, which is a step 2 level where we have wellbeing practitioners who offer 4 to 5 sessions of therapy over the phone. And that is, again, for any of the disorders I mentioned earlier. We have a slightly kind of larger intervention, which we call a step 3 intervention, which are qualified by step 3 clinicians. So these are CBT therapists, they're counsellors, DIT therapists, interpersonal therapists, counselling for depression. So these are some of the interventions and modalities that we use. So when a person is referred into our service, essentially they get a call very quickly within a couple of days, the latest a week, where we would conduct what we call a telephone triage, which tends to last about 40 minutes. And on that call, we're trying to ascertain what the basic presentation is and if our service can support them. And ideally, if they fit the criteria of what our service can provide, then unfortunately they are placed on a waiting list. And at the moment, those lists can kind of fluctuate between sort of 18 weeks upwards, which is a long time to wait for therapy. So that just kind of highlights the demand that is there on our service. And then they will be seen for a course of 12 sessions of cognitive behavioral therapy, or they can go up to a limit of 14 sessions if it's a form of counselling or trauma therapy. But the criteria is quite specific. So I think that's why our screening process is quite essential. So whenever we do get a referral, we do make sure that the client who's referred to us is suitable for an intervention through Ealing IAPT. We do work very closely with our secondary care partners. So if we're concerned in any way or we're worried about any of the clients referred to our service, we can forward on to emergency services such as single point of access or the primary care mental health services. So I mean, that is the kind of work we do. The difficulty, as I said, with the COVID environment that we have at the moment is that we're not offering the face-to-face sessions. So a lot of the interventions that we are delivering at the moment are done via telephone, which would be an ordinary step 2 intervention anyway. So there's not much of a change there. However, with the step 3, what we would refer to as previously face-to-face, if the services were functioning as normal, clients would come into our services for face-to-face therapy, which unfortunately they can't do at the moment. So we've had to work very quickly through this COVID environment to set up these online platforms. So we are currently using 2, which is the Attend Anywhere platform, or the Microsoft Teams. I mean, that seems to have come a way forward for a lot of the things that we do, whether they're client work or whether it's meetings that we're having within the service. So we are able to offer these virtual face-to-face sessions to anybody who has been stepped up for a step 3 intervention. And they may include, as I said, a typical example would be for depression. We look at behavioral activation. We look at cognitive styles in terms of what might be coming in the way, what challenges that they have. And it could be sometimes actually, they're not suitable for therapy and more suitable for other services. So we quite often signpost to the voluntary sector. We may be doing referrals to advocacy support services. So we do always make sure when a person comes to our service for support, we don't just leave them. If they're not suitable for us, we will always follow up that referral and refer or signpost to an appropriate support service so that they're not left with nothing. But services are scarce. There's not enough funding for voluntary sector. So there is a huge gap in services, and trying to find an appropriate service to meet the needs of the community is sometimes very, very difficult. But in a nutshell, that is what we do within an IAPT service. And if there's any questions, I'm more than happy to ask or answer those. Is that okay, Toby?
Yeah, perfect. Thank you. Anyone got any questions for Mandy?
Can I ask a question?
Yeah, go for it.
Latvia, from each. We're one of the services that IAPT does refer to. Sorry, hold on. and I think it's been a challenge, like you said, for everybody, because equally as IAPT has experienced, our capacity has reduced with COVID. We've been inundated. And my question really was, there was a sense that IAPT had stepped down the support over the summer and focused more on the impact of COVID on people's well-being. And that in itself would have, that it created an additional burden on the voluntary sector without any additional resources going into those organisations. And we, for example, we have, our waiting lists have gone through the roof as well. And I think as a voluntary sector provider and provides therapy, and kind of like a step 3, I would say, in terms of the way we're working. We often find referrals come to us simply because somebody's gone, it's DV, it's ethnic background, it's a language issue, and I think there's a need to maybe have a bit of a wider discussion, maybe.
Yeah, I mean, one
outside of this meeting,
sure, absolutely. So
sometimes it's sorry, can I? Because it sometimes we're getting inappropriate referrals, and then we're holding the risk rather than IAPT, where we think that should really be held. And because of the voluntary sector, the nature of the work, we end up then doing all the other work, which is around the practical support, the housing, the employment, as well as holding them therapeutically. So I wondered whether there is something to be, explored a bit further in terms of making sure that, we're all working towards the same thing in terms of outcomes for our clients, but how we can work better on the ground. I think that perhaps could do with a further exploration and discussion outside of this meeting.
Absolutely, that would be fine. So I mean, of course, I can leave my details, and please do feel free to contact me. But I mean, I think one of the things we are very good at doing, I think there's been an increased burden on all services during COVID, but we do make sure that any referral that is kind of signposted or referred on, there is a consideration for what the needs of that client is. And I think also within that, we are having to find, particularly with COVID, is holding clients which have got other needs apart from psychological. So whether it's risk, or whether it's financial support, or whether it's advocacy support. I mean, luckily we do have an advocate within a service that we use, make very good use of her actually, and she is very good. But again, I think this is a lack of resources, but I'll be more than happy to have that further discussion to see whether we could do more close across boundary working, to look at more appropriate referrals, or where the challenges for both the services are. So please do.
Yeah, I would welcome that, especially as I think in the voluntary sector, we often funded by other funders to do work that we said we would do, and to meet, particularly to support people who actually don't even make it to IAPT. And then when you have a referral pathway where we get a lot of referrals from IAPT, it's not in our best interests or the client's interests, because we're then taken away from the work that we are meant to be focusing on to try to respond to an increased demand. And we're not funded to do that, if I'm being honest. And I can see in the I think that would be helpful to have a discussion maybe with other voluntary sector providers as well in terms of therapeutic work.
Absolutely.
Okay, we've got I can see Shalmarky's got his hand up. We're going to have just this one last question to Mandy, and then we're going to have to move on because we've got quite a few other speakers still. We've got jam-packed agenda. So Shalmarky, did you want to ask Mandy a question?
Yeah, I just want to echo what Latvia said from each. Because actually a couple of years ago, we tried to invite IAPT because we had experiences where some of our clients, did not get the right support from IAPT because of language, and especially individuals from the refugee communities. And we have a current project on mental health with BMER communities. And about 90% of our users who are from Afghanistan, Eritrea, South Sudan, they all have different levels of mental health issues. And as Latvia was talking about, there's other things like accessing housing support and all that kind of stuff. So we found that the app service hasn't been really useful for that section of the community. And as I said, we try to invite IAP to see if we can have discussions and see how, especially like you know, when people have to complete that questionnaire every time they come and see a therapist, I raised an issue around, there's a question that asks, for example, if somebody has considered maybe taking their life. So for a lot of community, when you have that kind of question, it actually puts them off. So I try to raise this matter. I think, as Lakvir was saying, it'd be good if maybe you have a session or something. We actually look at, because we are actually getting a lot of people who are looking for support, and we don't have the right funding. We don't have, I mean, we've trained 10 people, you know, volunteers as, you know, mental health support. Kind of, they've done level 1 in psychotherapy, but that's not enough. They speak the different languages, but just that, you know, we see on a daily basis people being sanctioned, people actually, after being supported through the mental services, they come back to the community, and then it's the community organization that have to pick up the pieces. So I think maybe a wider discussion would be useful. Thank you.
Okay, great.
Thank you for that comment. Again, please, you know, do be in contact with me, and I'll be more than happy to have further discussions on that.
Okay, lovely. Thanks very much, Mandy. That's great.
Toby, I'm going to have to disappear off because I've got a meeting. So, you know,
No
thank
worries.
you for inviting. It's been a pleasure seeing all of you, and thank you again, Toby. Take care. Bye-bye, everyone.
See you later. Okay, now we're going to move on to, well, the last meeting. Mint did a very interesting presentation, and I sent that around, and now really it's just an opportunity to put any more questions. Now you've had time to digest that information, and I think we've got Wanda here. I think she might have been joined by some other colleagues as well. So if anyone from Mint would like to just give us an update, a brief update in terms of how things progressed with the Mint project, and then we can put it out for a few more questions.
Hi all, so yeah, it's Wanda, and I'm here with some of my local colleagues. So there's Gail, the head of operations, associate director for comms, and we've also got Daniel on the call as well, who's one of the managers for one of the Mint teams who's joined us. So really great to see the local faces on as well. In terms of update, we're still working through some of the way that the interventions will be delivered within Mint, and we've recently set up a carer focus group as well, following last couple of sessions to ensure that we've got support for carers within the model. So that's on the 30th. You may have seen a request card go out to anybody who wants to join the session as well. So we're still working through that. There's still bits of recruitment that we need to finish on as well. I think there's a couple of outstanding roles from the original bid. We're still, in terms of other developments, we're still working on the pathways as well, because that's all going to change. So pathways won't be structured in the same way. There'll be no sort of wrong door approach, as we mentioned. So we're reconfiguring to ensure that people's needs are met more appropriately within Mint. So that's still being ironed out. And when we have more details, I think we'll share them with you. And then before any care changes for any service users as well. So there'll still be enough time to discuss all of that as well. We're in the process of trying to develop a training package as well. So that's looking at for our entire workforce and what skills they may need as we change the way we work with service users and carers in the model as well. We also recently submitted a bid to NHS England. So each year, as part of the long-term plan, we'll be asked to look at how we develop community models, and we submitted a draft submission. So this included work around a complex emotional needs service, what's traditionally known as a tier 3. We also did, so that was done with the MCN. And then we submitted a bid around supporting the 18 to 25 group as well. And we did some co-production on that with Young Minds and the CAM service, and taking feedback on that. And there was also one around eating disorders. So we'd worked with people who access that service as part of a focus group to develop that offer. And lastly, we're looking at a VCSE offer as well. So how are we putting more money back into community organisations. So that is still underway, and I'm probably going to be catching up with Nami as well to talk about how we can work a bit more around that. But within Hounslow, we are working and linking up with the council colleagues as part of their community grants programme, and be rolling out with their Wave 3 funding on that. So that's a really quick nutshell of the big highlights that have gone in.
Thank you very much, Wanda. Has anyone got any questions for the Mint team in relation?
Toby, can I just add in a little bit? Because I just wanted to say that I'm really listening to the stuff about, so Gail Deering here, sorry, I'm the Associate Director of the services. Just a bit about partnerships, but also the reaching out into the community stuff, which I really think has been central to some of the conversations here. And I think the bit for us is we're going to have lots of new roles which are going to be in teams like Dan's, which are going to be very neighbourhood based, with people like peer support workers and link workers, different types of workers that will be in our teams that will really be working alongside yourselves. And I think sort of addressing some of those things that you're talking about today, so working very differently. So I think that's really exciting that we're sort of moving forward with that, and we want to work closer with you, don't we, Dan? I don't know whether you want to say anything, Dan.
Yeah, absolutely. It's been it's been really good to kind of be at this meeting last month and this month as well, and kind of hear the feedback and kind of understand what the issues are on the ground, because I think that it can turn into this thing where we just refer people backwards and forwards and nobody actually gets treatment, and that's really what we want to end. We need to start thinking more about how responsive we are as a service, but also if we're offering something else, is that person actually going to get it, and how long is it going to take them? And I think we've been a bit blind to that in the past, and we really need to change that. So it's been really useful discussion today. I hope we can continue it and pick it up. So if anybody does want to join in for a meeting with IAPT and myself as well, and anybody else that wants to attend, can we just maybe just email me, or is it better to go through you, Wanda, or should it go through me? I'm not really sure. What's the best process? Or Gail?
So if they're local conversations, I'm quite happy for them to go through you, Dan. If it's more something that we're looking at, something on a wider level, then I suppose it needs to be wider. But really, that whole idea of doing this is so we're keeping the connections local and seeing what the needs are locally and addressing them locally and building those relationships with the teams, because obviously within Mint there'll be 3. So for one for each locality area. So it's making sure you know who the team is and therefore who else is in the community, you know, named people, rather than having a random address where you're just trying to find somebody.
Absolutely. So I'll just put my email in the chat box. If people can just get back to me, and then we can organise a meeting together. And what I'll do is I'll also get the other Mint managers as well involved, and also the service manager, so that we can all just kind of link up together. And maybe it might even be possible we have a regular forum, just so that we kind of have updates from what's going on. So let me just put my my NHS email into the chat. Please email me and I'll organise a meeting for us all.
Brilliant, that sounds great.
Can I say something very quickly, please? Hi. I just wanted to say that not to forget the vocational service that's in West London, because we link, well, not myself, but they already make links with a lot of people that are in these meetings, and I never hear them being mentioned. And I'm just wondering how you're linking with our own colleagues that are already got existing contacts with people in the community. So I'm just mentioning it because I don't hear anything mentioned from yourselves regarding those links. So that's what I just wanted to say, really.
Okay, yeah.
I can answer that more in. Sorry, Dan, did you want to? No, go on, Dan, you go.
No, I was just going to say, we actually have people based in our team at the moment who are part of our MDT as well. So they give input. And they're very well versed with kind of, you know, trying to find people kind of work and everything like that, particularly at this time as well, where it is really difficult in terms of employment for people. And they're kind of quite well versed and also helping people retain their jobs as well. So they are actually located in our teams, and we see them face to face on a weekly basis as well. So we do have close communication with them.
I am aware of that because they're my colleagues in your team. So I know exactly what they do. It's just that I don't hear them in your conversations. And I'm wondering, are they missed out, even though they're already located in those teams? So
no, absolutely not. Yeah, we have
No,
we regularly have
yeah.
those discussions at MDT meetings, and we're always including them as well in our thoughts, you know. And when we're kind of thinking about what the plans are for patients, it comes up every MDT about including them.
Yeah,
And
I'm just conscious of duplication of services, and I'm thinking about they've got quite good at making those links with people in the community. So anyway, sorry, Gail, I know you want to add.
No, Maureen, happy to have a conversation with you, because I can probably reassure you more around what's going on with that. Yeah.
Sorry, it's Lakvir again. I haven't quite got off the meeting. So my other one hasn't started. Thank you for that update. Couple of comments really. I've been in Mint workshops and I've had nothing come back as yet as to what the next steps are. So I'm left wondering what's going on in terms of the questions and the issues that were raised by the voluntary sector. So there's been no follow-up. And my other comment around the funding that Wanda you spoke about in Hounslow, I understand that is a little bit more forward than in Ealing. My question around that funding is about sustainability. It's 1 year, limited. It's not a lot of money. And I don't understand then how voluntary sector organisations would be able to access funding that's actually going to sustain their input and their partnership working to make what you're asking us to do, to make that happen in the long run. So I think there is something about sustainability in terms of funding and resourcing this from the voluntary sector side as well. And I'd be interested to see how that then is developed in terms of taking the work forward.
Yeah, absolutely. So it's always the same question we have as well about sustainability, and I think it's one of the discussions all of the trust have as part of what NHS England are asking us to do in terms of transforming community mental health services. One, that the funding amount is limited, and two, the sustainability. And we don't have the answer to that yet at all. We're glad that we have the money to give, but ultimately we just don't have the answer for that yet, and that's just being as honest as we can really be. It's not like we're not looking into what our options are, we're not sure either. We don't have all the information yet. It's just new information that we're getting somewhat now, and more information will come over the coming months. So that's really where we are with that. And in terms of the event, we should have some more information coming out about the follow-up and what's happening with the next event and what happened, and all the comments that came back from that. So that's coming soon. Lakvir.
Can I just interrupt, Wanda? Lakvir, what would be helpful for you? Because I'm just thinking about Dan's offer earlier to sort of perhaps get a bit more connected in with the teams. What would you ideally like to see in terms
I think
of
I think what I'm observing is generally across Northwest London, because we work across Northwest London, is that we're having the NHS coming to the voluntary sector to tell us what's going on, what changes are happening, what your intentions are. But I'm not actually seeing real engagement. And I think that's my concern really, is that a lot of it's very much about consulting and informing us. And at the moment, there isn't that loop that's coming back in terms of, okay, we've heard what you're saying, because at the moment, I don't see anything that's really changed. And I think I want to see that happen for us to actually go, okay, here's a buy-in from the voluntary. Well, I only speak for ourselves. Here's the buy-in in terms of that we are truly working in partnership. At the moment, it still does feel very one-sided. So I think, I welcome the opportunity to have more of these conversations and the discussions on the ground in terms of working together.
Yeah.
But it shouldn't be on the basis of what more can the voluntary sector do to help the NHS meet its objectives. No, when is the NHS going to help the voluntary sector meet its objectives as well, is what I'm saying.
Yeah, I suppose, sorry to hear
it's a much bigger conversation.
No, absolutely.
Okay, I think can I just add one point before you say? I just want to bring the community voice, because we're not delivering services as an organization, but we are very close in contact with the community and community needs. I can talk about one community, but I strongly believe it's not single issue like within one community. Probably it's across the board. So we're talking about services, and I have experience of having counseling placement in 2 services in Ealing. So I was on the other side as well, and I work around mental health with the Polish community, domestic violence, addictions, depression, family issues, And what I would like to say that from where people are looking for help, they mostly looking for help in Facebook groups, because what they need, they in terms of like counseling and therapy, they sometimes complain with IAP. They say, I don't want to fill up every week the form how depressed I am if I have suicide thoughts, because it puts me down. I feel even more depressed going into the topic. So it's a one issue. Another issue I hear around counseling generally is that it's just like going and sharing, but they need tools. People need tools how to manage their life, especially now with the recession and, losing jobs and worrying about situation, children acting out as well. It's a lot. So what they really need saying to us, and I think it's important also to, before creating a model, because I also have experience of like, there is a new model, and I'm struggling with the language, new terminology, but I feel it's lacking going to the community and listen to what the community needs. I know there is like co-production, and Kelvin is trying to organize that and hear people's voices, but we have the knowledge as a community organization. And the main thing, what is happening now, people need other people. It's less about therapeutic approach. It's more about sharing struggling and how they feel and being with other people, and how to do it in a COVID time. We need to look more holistically. How people need groups, and maybe sometimes it's a Facebook group or I don't know, more appropriate ways, on the Microsoft Teams. It's not appropriate for even I'm struggling with that. So Zoom is a bit easier, but for some people it's still challenging. So I think we need to think about the bigger picture and really go to the community, listen the needs before creating something. Thank you.
I'm going to let Gail respond.
I think Anna, that's so powerful. And I think, if we weren't in COVID at the moment, we would be moving around the community, wouldn't we? We would obviously be out and about, and we'd be able to meet with a group of people. And I think you're absolutely right. We need to think creatively with Dan and his managers and his teams about how we do work with you. So I think we just need to be, we're going to have to be creative, as you say, whether we do things digitally or whether we do start moving around and doing things in big spaces. I mean, we'd be up for that because we really want to listen and learn, don't we, Dan and Wanda? But it is very tricky at the moment, which is why we're here with you.
Right, I'm going to have to move this on. It's very interesting. I'm thinking maybe Gail and Daniel, if you want to maybe set some dates or something, and then maybe we can have another discussion. I can connect to everyone, forward it on this forum, but maybe if we have another discussion which is purely about this would be good. So I'm going to have to move this on. Apologies for that, but we have got a jam-packed agenda. And so now we're going to move on to Katie at the Recovery College for an update.
Just to say, it's actually going to be Alison, because it's really noisy where I am, and you're not. Okay. I'm not going to be able to do it properly. So apologies, but hello everyone.
Hi everyone. Hi Toby. Hi everybody. Hello. Yeah, I'll just. I think we just got a few minutes, haven't we, Toby? Yep. Just to talk through, I mean, I know we've talked before a couple of times about the Recovery College, so I'm hoping that people are familiar with what we do anyway. We're obviously part of the trust provision, a learning environment based on an educational model rather than a therapeutic or clinical model. As people probably know, so our ethos is very much steeped in recovery and the belief that people can become experts in their own recovery and that they can live good and meaningful lives. Our culture is very much around co-production, co-sharing power. We develop courses and deliver courses with a combination of trained experience and lived experience. So we'll have two trainers. We develop courses in small groups of, as I say, trained and lived experience, and we deliver with two trainers, one of whom has primarily lived experience and one of whom has primarily trained experience, obviously recognizing that people can have both, can't they, of course. Our students are made up of service users, people who use services, and also carers and families, friends of people who use trust services, and also staff. So our own staff and also staff in relevant community organisations. So I'm guessing lots of people that would be sitting in here today, you know, the staff from your, you know, your colleagues would also be eligible. Obviously, not in vast numbers, please. We have had organisations in the past who've kind of used us like their in-service training. So not huge numbers, but all together, should I say? But obviously, we're very, very happy to see students coming from local organisations. What else to say? Eligibility is really important, and that's going to change with the Mint changes coming in. We're not quite clear, but it will be a much more broad eligibility. So currently people need to, for service users coming to the Recovery College, they need to have used trust services, be using them currently or within the last 2 years, and or be sort of supporters, friends, families, carers of, you know, of those people as well. So that's important, and we're really keen to broaden out that eligibility criteria. And as I say, that will definitely happen very soon in relation to Mint. We're not quite clear how that will look yet, but we'll hopefully have much more of a preventative role as well. So hopefully getting, you know, being able to equip people with skills and tools to be able to manage their own well-being and you know, mental health issues, hopefully long before they need to use secondary mental health services. That would be the idea. We're currently operating via Zoom. The Trust would like us to move towards Teams, and we are sort of working on that, but also acknowledging, I think, as somebody has just said, how much more inclusive Zoom is really for people. I think people are much more familiar with Zoom, but the Trust would prefer us to use Teams. So we are working towards that. We've just had new IT equipment, and so we're hoping that Teams will be a little more reliable, which we haven't found it to be so far. So we've been pretty much, I mean, since April really, you know, lockdown was what, the end, 22nd of March or thereabouts. So that just sort of cut into our spring term. We stopped courses, but literally only for a couple of weeks. We then had our Easter break. So we run on a termly basis, as people probably know. So we then had our Easter break, and we were up and running on Zoom following our normal prospectus courses really from April. So we've continued to do that. It's been really interesting. We've adapted material, but we never would have dreamt it, but actually it you know, it works well for some people. It's very accessible for some people. We would never ever want to replace face-to-face contact, but going forward we will definitely keep an online element. It's yeah, it's been really, I mean, I think it's been interesting, and it's as I say, you know, it's been accessible for, much more accessible for some people, and as well as that, we will also have recorded material so that people can access it in their own time as well. So it's been, you know, we've definitely learnt, and will extend our offer as a result of what we've experienced in the last, you know, since March. Our new prospectus, so I'm guessing that people are familiar with the types of courses that we do. Broadly, I mean, we have about 50 courses developed, but sort of broadly around understanding and managing mental health, around sort of building lives, understanding a bit more about recovery, looking at lots of well-being stuff around mindfulness, relaxation, exploring spirituality, confidence building. Lots of different courses. We also link closely with our vocational service colleagues. So we have training around helping people to you know, think about getting back into work and training. So we've got an element of those in our prospectus as well. Our new, so normally our prospectus would cover the 3 terms and would be a sort of broader. But during lockdown, we've done our timetable term by term, which again has actually been much more straightforward for us to administer, and much cheaper as well. So I think we will continue with that. And hopefully, Toby, I don't know if you've got, I can certainly send you a copy of our current, so this is so we're obviously coming to the end of, we've still got a fair bit left in of our autumn term, but we've just literally this week, early this week, our spring term timetable has come out. So I can send those to you. I can send that to you to distribute.
That would be great.
The other thing just to mention, again, I hope that people, the information has certainly been sent far and wide, but there's been a really interesting partnership between the occupational therapists and the recovery colleges in central and northwest London and ourselves, and we've produced weekly webinars which are underway. I don't know if people are familiar, but they are aimed at people with ongoing symptoms of COVID. So I think kind of used to be called long COVID. I'm not sure that we're using that term anymore. And so the students, obviously, those are webinars. We've had big numbers, sort of between, I think around sort of between 60 to 80 people on most of those. So it's 9 weeks, and we are about to go into week 6, but those are likely to repeat in January. Obviously, it doesn't look like COVID is going away anywhere anytime soon, so we're likely to repeat those in January. And it's really straightforward. They're open to anybody at all, and you just click on the link. And again, I can send that to you, Toby. That's gone out mainly via the GPs. It's obviously a very different student group than our usual student group. So it's gone mainly out via the GPs, primary care. This next Tuesday is how to manage tiredness and fatigue. There's also a session around returning to work and support there, looking at healthy routines. And then there's a more general one around coping with Christmas, which is right up to, that takes us up to the 22nd of December. So those are open to anybody. Obviously, they're designed for people with ongoing symptoms of COVID and helping them to address those, but actually they're also open to anybody who's interested. So you don't necessarily have to, they're kind of very general. There's been 2 sessions around managing anxiety, sleep, low mood, mindfulness. So those have been very well received so far, and it's likely that those will continue into next year as well. But I'll send that to you, Toby, along with our new spring timetable. So I don't know if anyone's got any questions or anything. Katie, I don't know if there's anything that I've missed out there.
No, I don't think so. I think there was lots of stuff. Sorry, there's still the leaf blower situation going on here. So I probably should turn my mic. It stopped. Just to add, we've also recently started working with Kew Gardens as well to set up a community music making group for wellbeing. At the moment, it's only once a month online. We may look to do that more, and then as soon as we're allowed back, we're gonna go back and so that's quite exciting. We've also got other kind of art projects ready and waiting for as soon as we're allowed to meet in real life again. So there's exciting things that are happening. And yes, what I think I'd like to add just about the doing things online is that we're finding we're getting a less dropout rate, which is quite cool. So yeah, it'd be really good to continue to do stuff online and with and I'd also like to add about the Zoom. I've delivered some training on Teams, and it is much harder, so fingers crossed that it becomes easier to use Teams. But yeah, Zoom is an easier platform for people. But I'll stop talking now. But
Brilliant.
And just to add before I finish, just in line with the Zoom, so we can help people set up. I think most of our students would have a smartphone, and we can help people to set up Zoom. It was obviously more of an issue, I think, in the early days. I think most people are kind of familiar with it now. We also have a very small offer here for we have a laptop, we potentially 2 laptops, so we can students can come here if for some reason they don't have access to either data or their own laptop or smartphone. So we do have a small capacity to be able to for people to be able to come here and log on from here and work from here on the courses. So that's yeah, just to let you know about that.
Brilliant. Thank you very much. Has anyone got a quick question for either Katie or Alison? We're getting a bit short of time, but if anyone's got any burning questions. No. Okay, well, thank you very much, Katie and Alison. And now we're going to move on to Meg, who's going to just give a quick update on the I put on the agenda World Mental Health. It was actually Stress Awareness Day. Yeah, I attended the event and it was brilliant, organised by Meg. So Meg, do you just want to give some feedback from the event?
Absolutely. So hi everyone. For those of you who don't know, I work for Each Counselling and Support. I'm currently the project coordinator and the mental health support peer support worker for our project called STEPS. And STEPS is our project that's funded by the Ealing Borough. And on the 6th of November, so quite some time ago now, which is crazy to think, but we hosted our first ever virtual roadshow to mark National Stress Awareness Week. So National Stress Awareness Day was on that Wednesday, which was the 4th, but the whole week from the 2nd to the 6th was all about stress. And we used kind of an innovative town hall style format to kind of explore this session, trying to figure out things about what are the key causes of stress, how stress looks like and manifests in our daily lives, how we can all create our own stress reduction plans and how we can support those around us in managing their own stress. Overall on the day, we had 4 speakers. So we were joined by a few of the members here. So we had Kelvin from Cape, we had our own Toby here today. We had Mandy from IAP, and we also had the MP for North Ealing, so that was James Murray. And then we had 2 hosts and we had an audience of Ealing residents. So it was a really great turnout. But some of the quick things that I'd love to be able to share with you guys is that we clearly could see that mental health in Ealing Borough is being tackled via various different formats. So it was being covered by obviously charities, the voluntary sector, NHS, schools, politics, faith groups, and etc. We realised that stress obviously can affect us all and will affect us all, particularly during COVID. Stress has impacted so many people. And we've also had conversations about moving into the end of the year and the festive season, how stress is going to be affecting so many more people, especially around planning for how this year is going to go and the future year to come. But most importantly, what you're doing around the festive season. Will you be able to see your family? Will you not? Stress can affect our physical health. So many of service users are actually being impacted by stress physically, which we've noticed, and stress can impact our daily lives. Something else that we wanted to kind of share is that lived experiences are super powerful. So our conversation had a lot of people being super brave and sharing their personal kind of experiences, which is really impactful and empowering. And what we've been told is that people want more of this. And if there's anything that we need to take away is that creating safe spaces where people can actually talk about their mental health is really important in this season, especially when we still cannot come and engage in physical spaces. So people in Ealing are looking for safe spaces. And something else that was really, really useful, at the end of the session, we held a guided meditation session. So when everyone was talking about how therapy is not the only way to treat mental health and mental illnesses, having practical tools is really important. So we embedded a guided meditation session, which was really powerful, and we had a lot of great feedback. So what I'd love to ask from you guys is just some sort of feedback about what we could possibly do moving forwards. We would love to kind of redo these sessions, especially in the new year, looking at different topics and maybe have some collaboration. The main thing that I'd love to be able to push is getting more service users involved. So if you've got any service users who have incredible stories and are moving towards the end of their time with you, we're looking for volunteers. So that's the second thing that I'd love to just push out right now, just a shout out. For STEPS, I'm currently looking to recruit more peer volunteers. So that's looking at people who have lived experiences in mental health and have been through the service system. So if they've been through the NHS or the voluntary sector, and are looking for people who have the kind of potential to feel empowered to share their own stories. As well, something that we like to push is the diversity. So when Anna talked about basically these communities like the Polish community, it'd be great to incorporate them as well, because mental health doesn't have a face, it affects us all, and being able to kind of showcase all of these stories is incredibly important to us. So yeah, so we've had some really great things, and I can't thank the Mental Health Forum enough for their constant support. So thank you, Toby, and you were a great speaker, by the way.
Thank you. So did you want people to put in the chat right now maybe some ideas about future sessions?
Absolutely. I think because we're stuck for time, I would just put my email address there, and if you would love to kind of shoot me an email, I'd be really, really appreciative of that.
That's great. I'll send your email around to remind everyone as well. Okay, thanks very much, Meg. Right, let's move on to Shelley from Mind for an update.
Hi, Toby. Thank you. Hi, everyone. So I'm Shelley, and I'm here from Hammersmith, Fulham, Ealing, and Hounslow Mind. And I'm a team leader for advice and support, and I work on the Pathways Out of Hospital project. I'll just give a brief synopsis for our services at the moment. So the Pathways project, we're trying to prevent clients from getting into acute admission. So we're providing practical support with benefits, housing, and helping them with benefit appeals, etc. And we also have advocacy services for people in the community and working in Ealing Hospital. We also have a new project, the Limit Loneliness project, obviously helping people with isolation, and which is also based in Hounslow Borough. And we have psych education, also based in Hounslow. And these are two services that provide peer support groups, one-to-one intervention, coping strategies, and shared experiences. We also, during the pandemic, implemented My Mind TV just to help as an online platform to help people just, again, with guiding tools. And so that's it from me.
Has anyone got any questions for Shelley? No. Okay, great. Thanks very much, Shelley. So I'm going to talk about the future of this forum in terms of changing it slightly into the first half to be more on adult mental health and the second on youth mental health, thinking about the growth in that area of youth mental health. And I was thinking it might be valuable to have two separate sections to this meeting. So I just wanted to really put it out there to gain people's thoughts on changing that format if they think it would be a good idea. So I'm just looking for a simple thumbs up or hands up if you think that is, or has anyone got any thoughts on changing the format into adult and youth sections?
It would probably make it easier, Toby.
Yeah.
Everybody's all in one session, and I know lots of people talk about provisions for young people. Whereas for me, that doesn't apply to me. I'm more interested in the adult provision. So it might, from my point of view, it works.
Okay.
I think for me, Toby, there's something about being completely ageless, and I absolutely think we should perhaps spend time sometimes, you know, as you say, younger people, but also older people and mental health. So yeah, I think focus time would be good.
Okay. So that was my first kind of wanting to gauge and your thoughts on that. And the other thing really was to do with the next forum, because with Christmas coming up, then if we squeeze a meeting in for the Friday the 18th, so that would be in 3 weeks' time, how do people feel about that? Or would they rather that we wait until January? So again, just looking for kind of thumbs up if you would like to do that.
Sorry to interrupt. Just depending on what the time is, because I've got in my diary that there's a Mint workshop that day.
Oh.
Oh no, Toby, that's a major clash.
Don't worry then. Well, maybe we could do the 17th.
No. I tell you what as well, Toby, me and Dan were just looking at the diary and seeing if people wanted to meet with us about in more detail about Mint on the 9th, weren't we? Just an hour on Teams or something, weren't we, Dan?
Yeah, absolutely. And I think also we could take on board what people have said about Microsoft Teams being a bit inaccessible. So we'll make it a Zoom meeting as well. So I was just going to ask if we could if I could send you the link, Toby, would you be able to send that out to everybody?
Yeah, of course. So the 9th. And then, yeah, maybe
at 2 p.m. please.
2 p.m. And yeah, maybe if then we do this mental health session again, if we do it on, just look at my diary, yeah, the 17th, Thursday the 17th, so it doesn't clash with anything.
That's good. And Toby, that's something about for me about we've been talking a lot across the teams about what's on offer in Ealing across Christmas. I don't know whether there's something that I'm very new to the area. Sorry, I don't know whether you produce something or whether that it tends to go on the council website or what happens. I know there's really good information that Ben sent me on all your different services, but just particularly about what is actually going to be available for people, because there'll be a lot that won't be open as normal, won't there?
Mm. Yeah, that would be great if you can share the information that you've got already about that, and I can maybe at the next one we can then everyone can bring information and then we can share that around as well. So no, that's a really good point. That's great. So the next thing I've got is Kelvin wanted to talk about the co-production charter committee. So over to you, Kelvin.
Yeah, thanks, Toby. Just so yeah, I'm thinking it should be relatively common knowledge by now, I think. So I'm in the process of getting a service user committee together as part of the kind of co-production charter project. Just to quickly sort of recap on those, for those who are not too sure what that's about, is that we kind of feel that there is the need for some kind of agreement on how co-production works in the borough. And obviously we can do that at a kind of service provider level, but it wouldn't really be co-production without having kind of the service user contribution as well. So what I want to happen is for there to be a committee of service users who will be able to feed into the sort of main discussion with, you know, statutory services and NHS, you know, local authorities and so on, that they're actively part of the process of creating the charter, which I think would be sort of the most important part. In order to do this, we're going to need service users who want to be part of the committee. So I'm asking if you are able to kind of promote this with the service users within your organizations. So we're looking for perhaps 6 or 7 members in total. I think any more than that is going to be a bit hard to manage. Who will be part of the committee and who will also have a representative within that service user committee to be part of the discussions with everybody else. I did send out, I have to admit, a rather shoddy looking advert earlier this week, I believe. So it might not be in everybody's inbox, but it will be in some people's inbox. I will send out another one soon. But if you're able to kind of promote that, that would be absolutely great. Unfortunately, there will be no payment, but I have arranged with Groundswell to provide training for people who want to take part in the committee, so that they're able to contribute in the same level as you know, people who are more professional, you know, who've got more professional experience. We also wanted to do that as well because we want to be able to provide people with more employability skills. So it will be something that people will be able to get value out of and it's not going to just be a kind of a 5-minute project. Really, it's something we're looking to, will take several months to complete, I think. And I'm hoping that it will be something that will be extended beyond the creation of the co-production charter as well, and ensuring that the service users within the borough have more of a say overall of what happens and are much more involved. But this seems to me like the good ideal starting point, since everything is kind of having to renew itself. This kind of struck me as the ideal time. So please do promote that among the people who are using your particular organization. And yeah, you can pass on my email, which I will add to the chat briefly. Yeah, is there any sorry, I know I've waffled through that, but any questions about that so far? Other than I will probably call people up as well over the course of the next week as a reminder as well. So it's not going to work without service user involvement, and it's not going to work unless people promote that. So please do that. I've got a couple from Cape, but I don't want it to be just a Cape thing. It's got to be a borough-wide thing. It has to come from from a broader spectrum as possible. So please do that, please.
That would be really great, because we've got people that are engaging with Cape, even though albeit by telephone at the moment. Will your information will go via Toby in terms of what you're proposing?
Yeah, but I'll send it to Toby as well. Absolutely. Yep. And yeah, and I'll put my email up as well. And so, if people want to get in contact directly, absolutely, I can do that. So yes, Toby or myself. But yes, thank you. I'm absolutely begging people to do this, because it's not going to work otherwise. And I really want it to work. I think it has to work. So thank you. Can I just quickly mention one thing that I probably should have brought up a lot much earlier, sort of putting on the ECN hat quickly. We did have a discussion with Niha from CCG about a week ago about multi-partnership working. And there was quite a strong emphasis on working with the voluntary sector, and in particular with smaller groups as well. So they are very keen on having the voluntary sector at the table. So I think a lot of the issues that were brought up will be addressed. But having said that, I think it'd be really helpful for the discussion among the smaller groups to be happening much more, to get the kind of experiences of that. So that's going to feed into what's happening at CCG level. So yeah, but of course that's going to take engagement on all sides, I think. So it is happening. So is there anything else I can add to this? I don't know if you wanted to yeah, okay.
That's great. Thanks, Kelvin.
Sure.
Oh, wow, and that brings us up very nicely to 1:30. I was a bit concerned because you had so much on the agenda.
Toby, can I quickly ask you a question, Toby? The food bank, which is at the moment, is just like, it's not working that great, correct? There is no delivery at the moment to anybody. We have a lot of issues at the moment because some customers cannot go out of the house, and they said they can deliver only after 2 or 3 days. What will happen in the Christmas time when somebody is stuck? Is there anything you know about? Anything they have been changing or something?
To my knowledge, they are still doing deliveries to people who.
But it takes 2 or 3 days. Maggie, do you agree to me? We have few incidences that take 2 or 3 days to deliver the food bank.
Really?
Yeah.
Right. I didn't realize that it takes so long.
I've got a customer had to wait. He rang them on Wednesday, and he's getting it delivered sometime this afternoon or something.
Right. I will talk to Janet at the food bank and find out exactly what's going to happen. I'm just making note of that over
I think you're
Christmas.
right, Pro, 2 or 3 days normally.
Yes, yeah, it's like 2 or 3
If
days.
they ring that number and they can't get out of the house, it's
right.
2 or 3 days.
And I think it's only one food bank working at the moment, Hanwell one, correct, Toby?
Yeah, it's because
Yeah.
Hanwell's the
Roxana from Northolt PCN, social prescriber.
Hi, Roxana.
Hiya, the Trussell Food Bank, if that's what you're on about, only deliver on Tuesdays and Fridays.
That is no, we are talking about the delivery at home because people who can't come out.
Yeah, they do the home delivery. If you're
But
ordering,
they take 2
them,
days. They take 2 days, Roxana. That's what our experience. The last 15 days, our experience is they take minimum 2 days to deliver the food.
Are you ordering from Trussell Food Bank? Is that the one that you're
From
sending?
the food bank. Food bank.
Yeah, that's because there is only one Ealing food bank, and
Yes,
that's
they only deliver on Tuesdays and Fridays between 10 and 4:30.
And maybe that's why my customer's getting it today, because
Yeah.
it's gone up. Maybe those are the days, as Roxana says.
Could
but I
be,
do
yeah.
know they do try to deliver close to where the person lives or to the person. So they don't have to go, it can be quite close. I had somebody in Southall, they delivered it to somewhere very close.
I don't know if you're aware of the Matthew. I forgot his surname. Matthew creates and regularly updates information about free food in Ealing, and they recently added Hanslow, and one version is in Polish because he had Polish volunteer as well. But it's quite good and regularly updated information in writing and with additional signposting services. So I think it'll be good. I'm sure, Toby, you get it, and some people probably in here getting it. So it's quite helpful.
You mean Matt Coolham?
Yes, yes.
I'm very pleased to announce that Matt Coolham has just joined the ECN exec of financial inclusion.
Oh, sorry, it's not Matt Coolham.
No, it's a guy from Ealing
ESAS.
Council.
No, it's a volunteer. It's a volunteer.
My
who
apologies
works,
then.
Yeah,
Matthew
it's
Skinner.
Skinner, Matthew
Yes.
Skinner.
Yeah.
Sorry, yeah, Matthew Skinner. It's doing this as a volunteer of Soup Kitchen.
Perfect. I'm
Yeah.
sorry I got that.
Yeah.
But
It's
I'm not
really,
sure how
it's
that's
really
going to
good.
help people who can't really leave their homes. Because
That's what
But
I
there
mean.
is-
Yeah.
But there is information about all varieties of free food. So I'm sure there is, other stuff available, not only when people getting the cooked meals and, I'm sure he involves, food banks as well. If not, then Toby, it'll be good to add information to him because it's been spreaded along across the board.
Ellie, did you want to say something a minute ago?
All I was going to say is that the Southall based food project, which is also delivering, but again, it's only 2 days a week because it's entirely voluntary led. But that we are doing limited deliveries. Most of the people are now coming and collecting parcels. But while we've been in this additional period of lockdown, we have been doing 2 days a week, and people are, people who can't get to us, who let us know that there's a reason they can't come and collect their parcel, have been provided with deliveries. So we are getting probably 20 or 30 families a week are getting their parcels delivered. So particularly if they're in that sort of Southall area and you've got people who are struggling to get deliveries, Toby can share my details. We've got a specific project email address that I can share, which is if you need to get hold of someone about the Southall.
Do you want to maybe put that address in the chat, Ellie? Yeah, cool. But I will have a chat with Janet at the food bank to find out what's going on over Christmas.
Yeah.
And because it's the Hanwell Food Bank is the warehouse, so it all operates from there. Everything's donated there, and then the other food banks over the borough aren't open at the moment, with the exception of Southall, because there's such a lot of demand there. But I will ask Janet what's going to happen over Christmas, and I'll make sure I send that to you.
Toby, are you aware of the City Harvest Food Bank?
Yes, we don't really because City Harvest is more sort of fresh food, so it has so many different networks. It's very sophisticated in their network because it's fresh. So you can sign up and then you get a text alert when it's in your area, and then you have to get the food from the place there and then. But yeah, it has a very quick distribution network because it's fresh food. But yeah, it's very good to see Harvest. Okay then, so it is just over 1:30 now, so I hope you all enjoyed that. It was certainly a packed agenda. I felt like we were having to really kind of get through it. It's a shame we couldn't talk about some things for a bit longer, but then it was great that we covered so many different things. And yeah, we'll hopefully have another catch up on the 17th, and I will follow up with all the information that we've discussed today. And also it'd be great now we've got that date of the 9th at 2 o'clock, that meeting with Daniel to talk a little bit more about Mint. That would be great to have another session there as well. So
brilliant, thank you.
Okay, I'll see you.
Toby, can I
Thank you,
just
Toby.
last good news?
Yeah.
Can I just share it? Sorry,
Yeah, please do.
just a few seconds. As I mentioned, that someone recently, 2 our clients had died recently that we supported, a 33-year-old and 69-year-old Polish person, and there were long-term rough sleepers and people with substance misuse issues. So we're trying to change, you know, something negative, something sad into positive action. Like they call it post-traumatic growth or something in psychology. So I'm working hard on getting funding, and as a crazy initiative, like in terms of time, we try to do film, the documentary about available support for rough sleepers in Ealing. I mean, it's about Polish, so I hope it'll be in English Polish version of the video. It will be 10 minutes, and we will share helpful resources. So fingers crossed we can do it. I have a film crew in Acton that can help us with that. So yeah, it's something positive to finish off, because I shared challenges, but it's also good stuff happening. Thank you.
Well done, Anna.
Okay, thank you very much, everyone, and see you all again soon.
Thank you.
Bye.
Bye, everyone. Take care.
Thank you, bye.